All right. And we are recording. And so tonight's presentation is presented by Dr. Alexis Chesney, who's the author of the book, Preventing Lyme and Other Tick-Borne Diseases. I should hold it up a little more. She's a naturopathic physician specializing in the treatment of Lyme and other tick-borne diseases. She works with patients at Sojourn's Community Health Clinic in Westminster, Vermont, and serves on the board of directors of the Lyme and Associated Diseases Society. You can learn more on our website, dralexischesney.com. I'll put that in the chat. And with that, I'm going to go away and turn it over.
Hi, everyone. Welcome. So I should be screen sharing and hopefully everyone can hear me. Otherwise, let me know, Meg. So I'm a naturopathic physician and I work at Sojourn's Community Health Clinic, like Meg mentioned. First, thank you to both Meg and Jerry for making this possible. I'm passionate about Lyme disease prevention. So I'm really excited to announce my book and to imbue this evening with a lot of amazing information so that you can be equipped to go ahead and enjoy the outdoors as spring is arriving in a safe way regarding tick bites. So I work full-time at Sojourn's, seeing patients, and over the last over a decade, I've seen many with Lyme and tick-borne diseases, and that's my specialization. And so as time has gone on, I became more and more passionate about trying to help people not get Lyme in the first place, or even if someone had healed from Lyme disease, sometimes they'd come back after a tick bite after feeling well and then acquiring another tick bite. And I really just want people to get this information so that at this point, hopefully we can end Lyme disease through prevention. So let's get started. This is just an article in the Library Journal about my book. That was exciting when it came out last year during such an interesting time. So glad we can do this virtually. So prevention is the best cure. Without an effective vaccine, accurate testing, or simple, effective treatment, each of us must do our part to educate ourselves and each other in order to stop the Lyme disease epidemic. So today we're going to go through ticks, and then I'm going to talk about tick-borne disease. Then we're going to talk a lot about prevention and a little bit at the end about acute tick-borne disease. We have a lot to cover. I'm going to go through these slides in the beginning somewhat quick. It's all in the book, so you can certainly get a copy and see it all. So just to get started with ticks themselves, I really want to help people be able to identify ticks themselves because there are different kinds of ticks throughout North America, and they carry different pathogens. In this area, we're going to be mainly looking at black-legged deer ticks, and also the Lone Star tick is making its way up this way. So those will be the first couple that we go through, and then the rest I want to go through, but not as quickly. So this is a list of the North American ticks, and here we have our black-legged tick. So this is the one that people hear most about, right? It carries Borrelia burgdorferi, which causes Lyme disease. It also carries Borrelia mayennoi and Borrelia miyamotoi. So mayennoi also causes Lyme disease, but miyamotoi actually causes tick-borne relapsing fever. Of course, these are all Borrelia, so they actually cause very, very similar symptoms and are treated the same way. Also, the black-legged tick can carry Babesia, Anaplasma, Ehrlichia, and Powassan virus. So there's a lot that this one little tick, this one arachnid can carry. And just notice how it looks. Look at this circle of black near the head, near the mouth parts. That is how I recommend that people identify the tick. This is an adult female deer tick, And that nice tan part, which might catch your eye a little bit more, only is seen, it only looks that way when they become adults. So the larvae and the nymph do not have that nice reddish tan back. So when the adults are out, you will see that, and that will catch your eye, and that's helpful to know it's a deer tick. But with the smaller ones, definitely look at that black dorsal shield, which we will talk more about in upcoming slides. So this is a page out of the book. I really wanted to give people an idea of the range where you find these ticks. So most likely, most of us are in Vermont or New England right now, but if you're not, then please look for your state. And also, you know, many of us probably travel and we may enjoy the outdoors and other places. So I think it's really important to note when you get a tick bite, if you get a tick bite, where you are. And then you can actually use this guide to look up what the different ticks look like, identify it, think about, okay, what area am I in if you didn't save the tick, and what possible ticks are there and what they carry. So now we have the American dog tick. Now that we do have in this area, you've probably seen them, but in this area as of now, they do not carry pathogens. In other areas, they can. So Rickettsia rickettsii is a pathogen that causes Rocky Mountain spotted fever, and Francisella tularensis causes tularemia. So this isn't seen as much in this area, but if you go outside of New England, and maybe this will change someday, maybe it's changing now, it's hard to keep up as ticks move and pathogens are found in certain ticks over time that weren't found in them before. So I think we should become vigilant about this tick, but at this point, we're not seeing that they carry any pathogens in the area. And you'll notice that dorsal shield looks pretty different from the other dorsal shield of the deer tick. So that's going to be important when you're identifying these ticks. So this range is pretty wide throughout the United States and Canada. And a note on tick identification. So we talked about this, and just to compare that deer tick and dog tick. So looking at that dorsal shield is what's going to be most important. And so, you know, keeping this in mind, it's the deer tick or the black-legged tick that we want to be really careful with. And I recommend saving your tick and testing it. We'll talk about that later. Here's the Lone Star tick. So nice star on its back, a little round marking that lets us know that this is that tick. And here we have quite a list of other pathogens that it carries or can carry. Ehrlichia, 2 different species, Francisella, Heartland virus, and star eye, which is still a little bit of a mysterious pathogen. It hasn't been identified yet, and it causes Lyme-like symptoms. This is its range. And now we move on to the Western black-legged tick. So these are not found in our area. Similar looking to the black-legged tick, we could call it the Eastern black-legged tick or the deer tick, and carries similar pathogens. You see the range there out on the West Coast. Now the brown dog tick actually carries rickettsia, which can cause Rocky Mountain spotted fever. However, it's usually very rare to find a bite in a human. This is seen more with dogs, so sometimes there can be a little bit of an infestation in places like dog kennels, but rarely do humans get bitten by these ticks. And they are found quite in a lot of places. And then we have the Gulf Coast tick, Rickettsia and Ehrlichia, down south. Rocky Mountain wood tick, Rickettsia francisella, and Colorado tick virus. Out west. And then the soft tick, a really interesting tick. This one feeds overnight and it does not stay attached. So it's not even known often whether someone has gotten this bite. And this is more seen in cabins down south or out west or in caves. And this is Borrelia. So this is different species of Borrelia than Lyme. These cause tick-borne relapsing fever. And so that's the range. And this is someone new on the scene. No pathogens have been found yet that cause disease in humans in the Asian longhorn tick. You may have heard about that in the news over the last several years. And this range is probably going to be spreading, and we'll have to keep an eye on this tick. So let's move into the tick life cycle. So right now we're in the spring, as you know. Some people ask, well, when does tick season start? So I think it's really important to say that tick season can be any time it's above 28 degrees Fahrenheit. So you can go out in the snow and people will be shocked to find ticks occasionally if there is any vegetation, if it's warmer on those days in the middle of winter. I've had calls and people come in with tick bites during the winter. So it could be any time, and depending, especially on where you live. But often it's about now, end of March, April, May, when you really see more ticks coming out. So this just goes through the life cycle. We've got the larvae in the summer. They're going to attach to somebody pretty small. They're not going to move very far, so they're going to attach just to someone like a mouse or a bird. And then they're going to get their first blood meal. So then they will grow an extra pair of legs, get a little larger, and then become adults after they winter over. And then the adults will go out and get another blood meal. Actually, the males only need a little bit of a blood meal, a short meal, and the adult females need a full blood meal because then they're going to hatch out, or they're going to lay eggs to then later hatch out next spring. So the larvae are the size of a period at the end of the sentence. So I think it's important to note just how small they are compared to the nymphs, which are the size of a poppy seed. And when I'm in person, I miss doing this, although people laugh. I have these bagels that have poppy seeds on them and nymph-sized ticks. So we play a game of, can you spot the nymph-sized tick? We pass them around and everything. So I'm sorry you're missing out on that today, but it's a good way to train the eye to realize just how small they are. And then you go to the adults, which are sort of the size of an apple seed. Still pretty small. So this just gives you the idea of the tick season, right? So we have the bookends of green, which are the adults. So that's who we're going to be seeing. And those have that nice tan reddish back, which usually catches your eye. But again, the best way to identify a deer tick is by that circular dorsal shield that's solid black. And then later on in June, July, we go into the nymph season. And then usually people tend to think that the ticks are gone somewhere in August and September. And we might get a little lazy about our tick checks because there are less adults and nymphs during that time. We have a lot of larvae coming out, and we're just not seeing them very much because they're not really moving too far to find their blood meal. So they'll usually be on a smaller animal. So then in October, it really hits this other bookend of the adults coming out. So just remember, keep those tick checks up and all the other great prevention. So here's just to see how small they are. These are the nymphs that peak in June, July. And just a comparison there. Another way to look at it. And then looking at the size difference between the unfed and the engorged female. So at this point, that tan back looks totally different. This looks like a little raisin or something, a little pea or something like that. And of course, looking down to the mouth parts is where you're going to find that circular, solid black dorsal shield. And that tells you just what it is. Because some people bring in ticks and they're like, oh, it was just a dog tick. Yeah, it wasn't a big deal because it's big. So there's this myth how, dog ticks are big compared to deer ticks. And if it's engorged, that's another story, right? So that means it had a blood meal. And then if we identify the tick and it's actually a deer tick, then that's more of a problem because this larger tick, on the right side on the top is showing that it had a blood meal. And if you find that in your bed or something like that, it could be from a dog, it could have fed on you and then dropped off. They feed typically between 3 and 5 days and then drop off. So they will be attached for quite a while if you do not find them before that. So some people find these just around their house, right? And so that means it had a blood meal on somebody. And then we've got that lovely mass of eggs on the bottom there. And so this is just to show ticks attached to birds. Bird migration plays a part in the spread of Lyme and tick-borne disease in North America and beyond. And the mice, will come back to targeting the mouse population later in prevention. And then this is just a slide to show all of the tick-borne diseases out there. So of course the Borrelia burgdorferi we're familiar with, which causes Lyme, but there are just so many others that we need to be educated about and know about because the symptom presentation can be different from one disease process to another. Here's a list of statistics on all these diseases. And then we'll just talk about Lyme for a little bit now, get into the top tick-borne diseases so we can cover those. So in 1975, Lyme was discovered in Lyme, Connecticut, where it gets its name by Dr. Alan Steer. A lot of children at the time were having what they thought was juvenile arthritis. And then some mothers, some family members were becoming more and more concerned and actually had created this movement to try and figure out just what was going on in their small community. So interestingly, across the Sound is where Long Island, New York is, and that's where Willy Burgdorfer discovered the bacteria in ticks and discovered Borrelia burgdorferi, nicely named after him. So yeah, so I like to share this information when locally presenting. So just to see from when I arrived in 2010 in Vermont until now, just what it's been like. The incidence is not the number of cases, but incidents. So it kind of puts all the states on a level playing field regarding statistics. And so Vermont has been number one a few times, and New Hampshire, New England, it's really, we're on the front lines of Lyme disease here. It's a nice map. Now they come out with these every year. 2018 is the latest. They didn't actually have 2019 yet. We don't have those numbers yet. And then just to talk about different ways Borrelia burgdorferi exist and hide. So this comes into play when we do treatment. But Borrelia burgdorferi is a spirochete, a very particular kind of bacteria. It's that coiled hair over on the right. And then it can also ball up into a cyst form, that green blob. It's called a cyst form or round form. And that's the form that can be in hiding and not respond to antibiotics. So something like doxycycline will get to a bunch of spirochetes, but it will not get to that cyst or round form. So that's really important. And so I'm always thinking about this and discussing this with my patients when we do treatment for active Lyme. And then the third thing to think about is something called biofilm. Just that it's kind of a round shell that they create around themselves. A bunch of spirochetes get together and then they create this round shell. And so that's another way that they can hide. And there are only certain ways of breaking through those biofilms to then allow the spirochetes to be exposed and then addressed by other treatments. It's a pretty tricky bacteria. And these are the reported cases, the blue dots. So this is from 2012, and now we're going to switch to 2018. So here we are in 2012, 2018, looking a little more solid blue over there in the east. And then this was the graphic that we created for my book because I really wanted to drive home the idea that Lyme is found in every state. And of course, you know, New England is hit hard and it's found very much in the north central states as well as the Northeast, but every state and Canadian province are affected. And the CDC has reported about 30,000 cases every year, but they do admit that it only represents 10% of cases. So really this means about 333,000 new cases occurred in 2018. And then a Georgia study suggests that there are 40 times the reported number of cases. So that brings this to 12 million cases per year. And this doesn't count for misdiagnosis or other Lyme mimicking diseases. So when talking about Lyme, we'll talk about signs and symptoms. So you get a bit of an understanding about that, what to look out for if you've had a tick bite. So less than half of people recall a bullseye rash. Now this is a perfect bullseye rash. It's amazing when this happens and people laugh, but really if this happens and you find it, call your medical practitioner immediately, get on treatment, look at some, you know, more comprehensive treatments, maybe search out somebody like myself who's a Lyme literate practitioner. But this is a hallmark symptom. So it's really helpful if this actually happens. It happens up to 30 days after the bite. And this is actually diagnostic of Lyme disease because this will happen before any accurate testing can happen. So someone might say, oh, well, let's see, we'll test you. But you know, maybe it's a bullseye rash, maybe it's an erythema migrans, but we don't know. So we're going to test you, but you need to wait 4 weeks to have an accurate test. So if something like this happens, this is going to be a telltale sign that it is Lyme disease. Of course, it can be missed. It could be on your back. Usually they don't itch or hurt. Occasionally people do find the bite itchy, but generally this is not going to be a rash that bothers you. And so you could miss it. So doing those tick checks are really useful in addition to picking up on any sort of Lyme rashes. This is around a child's neck. It can get distorted, right? As it expands outward, it can get distorted over your body parts. These are some atypical presentations. And the disseminated rash, right? You can have multiple lesions in multiple locations. That means it's actually spreading, disseminated. So here's the list of signs and symptoms of Lyme disease. Now we have the rash, which again is not always that perfect bullseye. Flu-like symptoms, fever, new joint pain, new muscle pain, new headaches, joint swelling, like a swollen knee is a very hallmark sign as well. But it could be a different area of your body as well. It can affect the heart, it can affect the eyes, and you can develop neurological symptoms. Early on, Bell's palsy is something that you can develop, and that's a palsy of cranial nerve, which is like a one side, usually it's one-sided, and so you'll have a drooping and you won't be able to use that side of your face. So people might notice, like they might drool, like when chewing, they might not be able to close their eye on one side. And for this, acupuncture is amazing. In addition to proper Lyme treatment, acupuncture is really helpful. I do that with my patients with Bell's palsy, just to help with the nerve healing piece of it. Well, let's talk about anaplasmosis. So this is actually really common in Vermont more and more. We'll see the statistics on that. Not discovered until the 90s. And it causes symptoms 5 to 21 days after the tick bite. So this might show up a little sooner than Lyme sometimes, which takes up to 30 days. So the last 2 years, Vermont in the entire United States had the most cases. This is cases actually, which is pretty phenomenal for anaplasmosis. So here's our nice colored map. So the darker the color, the more cases. Everyone can see this. Usually if I'm not doing this virtually, I like to translate a little bit, but hopefully everybody has this right in front of you so you can see. And then here's the incidence of anaplasmosis in the United States. And then the way we did this for the book, just to show you which states anaplasmosis is found in. Many. So signs and symptoms of anaplasmosis. Now, I always pay attention to especially high fever and headache with anaplasmosis. Those are hallmark symptoms. It's often severe enough to bring someone to the ER. So most of these cases are being discovered and diagnosed and treated at the ER. And it's great to be able to get that again. You know, people say it's funny, but you know, to be able to know that you're sick and get it taken care of right away. Also, the testing for anaplasmosis at that time is accurate, and the treatment with doxycycline in and of itself is also effective. So that's all good news regarding anaplasmosis. But when it's happening, it can be pretty miserable. The good thing is that it's temporary, and if you get help, it can be very, very effectively treated. So fever and severe headache for sure, but you can also get these other symptoms: muscle pain, fatigue, nausea and vomiting, cough. There is a rash that can happen. It's not very common, but it's kind of a sort of dotted pinpoint or splotchy rash all over the body. So not just around the tick bite, like with Lyme, which is local around the tick bite, or with Lyme, you can have multiple circular pattern around the body. This is sort of, you know, around most of the body except the face, palms, and soles. So now we'll talk about babesiosis, also increasing in the United States. So discovered in 1969, it is a protozoan, not a bacterium. So the Lyme and anaplasmosis are both caused by bacteria, but this is a different microorganism, which makes it a little different in the way it's presented and means that the treatment is completely different. It infects the red blood cells actually, and it causes malaria-like symptoms 1 to 8 weeks after tick bite. So you need to look out for this one a little bit longer. So let's look at the numbers. So Vermont is 5th in the last 2 years. They're starting to actually track this, which is great. We don't have the numbers as you see from 2010, but we're noticing how the CDC and departments of health are taking this more seriously, which is really helpful. So this is their, the CDC's map there. So again, in areas where we usually see Lyme, but found in a lot of states. And then the signs and symptoms. So, so again, flu-like symptoms: fever, chills, muscle pain, joint pain, fatigue, headache. So there can be a lot of overlap with Lyme as well as anaplasma. A classic presentation would be excessive sweating. It could be night sweats where you're just soaking the bed. Heart palpitations where you're feeling like a skip beat or a pounding or something different like that. Air hunger, which is this sort of difficulty breathing, but at rest, not with exertion, that people have this like not feeling they're not really getting enough air in. And chest pain. So babesia can be really scary, and then to treat, well, in chronic cases can be scary, but if you get it acutely, it could actually be quite a relief. And again, if discovered and properly diagnosed, can actually be treated very effectively. All right, so let's move into tick control and tick bite prevention so we can learn how to prevent these diseases. So of course, thinking about tick habitat, right? So where do ticks like to live? They love border areas, like where your yard comes up to a wooded area or garden, wood piles, stone walls, sheds. They love leaf litter. So, in the fall with leaf removal, being really careful then. They love moist areas and the shade. So they love humidity and they don't like dryness. So we think of a big open field with, the wind coming. This might be a little safer, not that the ticks can't be there, but a little safer than some really shady area that's damp with, just moisture and, some leaves and brush, and, they're going to love it there. And so also ticks are more abundant in fragmented patches of moist deciduous forests with shrub understories. So that this came from some research. So that's really very interesting, thinking about suburbs. And so ways to eliminate tick habitat, removing leaves, trimming the shrubs, keeping the grass short. Now, keeping your grass short is not going to keep out the ticks. It's just going to help. So I would still be really careful, but it's going to help to do that. Clearing brush and debris from gardens, all of that is going to help a lot. It doesn't foolproof your yard from ticks, but it can certainly make a difference. And then so creating things like paths to walk, and using wood chips or even cedar chips. We'll talk about cedar later. That can be helpful. And then thinking of, who brings in the ticks. So certain animals, birds, deer, thinking about removing or keeping out those kinds of animals. And here's a graphic from the book. So just thinking about all that we talked about basically in an illustration. And then just a word on Japanese barberry, which was really interesting coming across this research. If you look at this map, what map does it look like? Looks like the incidence map for Lyme disease in the United States, right? In North America. So deer tick rates are significantly higher in areas of Japanese barberry infestations. So, something to consider, thinking about removing Japanese barberry or just being aware of where that is. That is where the white-footed mice are, and that's where ticks are attached to these white-footed mice. There was a study on that that was really interesting too. All right, so speaking of mice, 50% of larvae survived through feeding versus a possum. So I love this little, it's like people talk about guinea hens or, what can we do? Can we get chickens? Do they eat ticks? Like, what can we get in the yard? And, I think a possum is the answer. So they're a little bit of a blessing regarding tick control. They're so fastidious. They really clean themselves of ticks. So that was an interesting study. So other things you can do if you weren't up for that is to get some perimeter sprays and granules. So cedar side, I use their spray as well, which we'll talk about, but cedar essential oil can be really useful in deterring ticks and also killing ticks. And then these are just some other brands that have some essential oils used that are somewhat effective. One, Essentia IC3 is often available through some pest control companies. So I've had patients actually use that through a regular pest control company that comes in and sprays 2 or 3 times a year. And it makes a big difference. It's not perfect, you know, but it does make a difference. Those ingredients are different from the cedar, but you can also do the cedar yourself. Then there's this interesting fungal spray, Met 52. And so that was pretty effective, decreasing nymphal deer ticks by 55% on lawns and 85% on woodland plots. So that's another option that's out there for people. This is one of my favorite things, tick tubes. You can make them yourself or you can purchase them. So white-footed mice infect 75 to 95% of larval black-legged ticks that feed on them. So this is usually where the tick is first getting infected. They're not born with Lyme, so they need to acquire it from another animal before they get to us. So usually the larvae don't make their way to humans yet, so they're going to be feeding on someone like a mouse and might get Lyme or, you know, the other pathogens from that mouse, and then later transmit it to a human. So the idea is to give them something to bring back to their nests that would kill the ticks on them and their family members. So you treat something like cotton balls or material like that. You can save lint from your dryer, get outside, spray it down with permethrin. Now with permethrin, you want to be safe because it is toxic to our skin. So you wear gloves, keep animals away and kids, and let it dry. It takes about an hour or so. And then you put that inside those tubes, which you can save if you have toilet tissue tubes or paper towel tubes. Again, you could just buy these at Thermacell or ticktubes.com. Pretty sure that's the other company. They're just simple with their name. And so you put them out into mouse habitat, which is basically tick habitat. And it reduces your exposure to an infected tick by 93% on the treated property. So that is incredible. I've had patients come back from one year to the next, or, you know, the spring to the fall, and say, you know, we've been getting all these tick bites, you know, my whole family, every day we get ticks. You know, we need to do something different. And they put the tick tubes out. I recommend doing it 2 to 3 times a year. And people have come back and say, this is amazing. You know, I haven't seen a tick. We haven't had tick bites. So it really makes a huge impact. So I highly recommend this. And, you know, it's 6 tubes per 1/8 of an acre. So, you know, some people say, I have 30 acres, you know, we can't possibly do this. So in those cases, you know, just thinking about, you know, using a lot of these different strategies that we're going to talk about today, one of which can be the tick tubes, and maybe, you know, specifically looking at areas that are more high traffic. You know, if you have a yard, if you sit out in a certain area, if you have a garden, you know, try and target a certain area that's really going to give you a high yield. And maybe you can't do, you know, your full property. And of course, there are other places you're going to be going, and they may not have tick tubes. So there are other things you can do to protect yourself in those ways. But this can make a huge difference. So there we have the mice bringing back that cotton and killing those ticks. And then a word on pets, right? So so many people have gotten pets over this last year. Pet owners, unfortunately, we're at risk 2 times the risk of finding ticks crawling on us. And then 1.5 times the risk of finding ticks actually attached. So, you know, where are the dogs or the cats? I mean, often they're lower to the ground than we are. And they're sniffing around, and they get into leaf litter, and they get into places that ticks love to be in. So they bring in the ticks to us. So I definitely recommend treatment of the pets. This is not my forte. Of course, please ask your vet. There are a lot of different options out there. And, you know, a collar or the liquid for the back, those are going to be more effective in the way of preventing ticks getting onto the pets than the pill that the dog takes, which it's escaping me the name of it right now. Unfortunately, I do see a difference between that. The pill that will kill the tick once it attaches to the dog might be good for the dog, but then we do see more ticks on those dogs that are treated in that fashion. And of course, again, this is not 100%. I mean, ticks can still get onto pets that have Seresto collar, for example, but it's going to make, you know, somewhat of a difference. So some other ideas are doing things like treating the dog bed with permethrin, or you know, getting a sheet for on top of the bed, like over the comforter. If the dog comes up on the bed and is releasing ticks on your bed, you may want to put something down like a sheet. You can also bring that same sheet out to have a picnic outside on the lawn. So just thinking about different things like that. You can also treat a bandana and tie it around the dog's neck. You know, a lot of times the ticks are coming up on their face. They're sniffing, and so that bandana can make a difference. And you can also use Cedarside for dogs over 20 pounds. So not cats, but dogs. And the Cedarside is a cedar essential oil spray that we'll talk about. So yeah, so a combination of different things like this can really make a difference. And here's our Cedarside. So this is a tick repellent that is safe for the skin. So you can spray that on your skin, you can spray it on your dog. It does need to be applied hourly, I would say 1 to 2 hours, because it just wears off. So opposed to something like DEET that may last several hours, that's a chemical that people do use on their skin. You may or may not like DEET, so you could choose to use Cedarside, but you do need to keep in mind to apply it more often. In the future, I cannot wait for Nootka Shield to come out. They've got some amazing studies. It's the essential oil of grapefruit and the heartwood of yellow cedar. It was shown to repel deer ticks for 3 days. I mean, there's nothing out there on the market that does that, not DEET. I mean, it's amazing. That's safe for skin, and this is completely safe for your skin. So look out for this one. Hopefully it'll be out soon on the market. And then back to permethrin, right? So we can use permethrin on our clothing and on materials, like I was talking about with the dog bed or a sheet or something like that. So again, permethrin is toxic to our skin, so we don't want to spray it on our skin. And we just want to be careful if we do spray down some clothing or shoes or equipment or something like that. If you get it on your skin, just wash it off. It's going to be okay. But we want to prevent that. It kills ticks on contact for sure. And then, you know, there's some great studies out about permethrin. So for instance, if you're wearing permethrin treated sneakers and socks, you are 73 times less likely to get a tick bite. So this is another huge impact. So what I do, I put it on the calendar, started, you know, a few weeks ago at this point, got all the shoes outside, shoes and sneakers, boots, you put them all outside, you spray them down, you let them dry, hour or so, and then they're dry. And then when it's dry, it's okay to touch it. So you can touch your sneakers, you can wear them. That's fine at that point. And then if you do it yourself, you have to reapply every 6 weeks. So you don't have to do it every time you go out, but every 6 weeks. So I put it on the calendar, you know, 6 weeks later, bring everything outside, spray it down. And that is going to make a huge impact. While you're doing that, you could spray some socks down. You can also treat clothes. You do have to soak them. You know, it's a little more time consuming. It certainly uses a lot more permethrin. So for something like socks and sheets and clothing, I recommend that you send it away to a place called Insect Shield. They're an incredible company. It lasts 70 washes when you use a professional treatment like that. So that's important to keep in mind. It will certainly it'll certainly last a whole lot longer. You can't send your sneakers, so doing your own sneakers every 6 weeks, and then having your outfits for hiking or camping or gardening or whatnot. Or if you're a logger or if you're a farmer, then you want to think about having these clothes on every day, probably when you're working. And then the big question I get is, what if it rains? Then does it come onto our skin, and is that toxic at that point? So once permethrin is dried into the fiber, it attaches very, very tightly. So just rain or sweat will not release it. So that's not going to be toxic. So that's great news. It's the agitation in the washer. Like if you're washing it, that's going to release a little bit over time. And light. All right. So something easy, right, is thinking about using your dryer. So putting clothes directly into the dryer after coming in from outside. So here's another strategy to kill ticks. So of course, I recommend a tick check. They're very small. Maybe you miss one. Maybe it's on, inside of your clothing or something. So you can just put your clothes into the dryer on high. It must be on high. It must be 6 minutes, and that will kill ticks. If you wash your clothes first, it's going to need more time in the dryer. So like I said, ticks love moisture. They will survive the wash. And then you may have them crawling in your washing machine, which doesn't sound very good. So just going directly into the dryer would be great. Of course, that might be a little counterintuitive if these are dirty clothes, but this is the way to kill ticks. And so here we have our tick check. So just thinking about different areas. Again, they love moisture and darkness. So thinking about under the arms and behind the knees and between the toes. And I always see this in kids, in the scalp. I always have kids come in. So really checking the scalp. And you can use, your sense of touch as well as sight, right? Especially with hair, it's so hard. So just getting used to your bumps that you may have, lumps and bumps on your body, and just getting used to doing tick checks, both with sight and with touch, because again, you may have a freckle, and is that a freckle or is that a tick? And then with kids, it's great to really make this a habit. Hopefully we're brushing our teeth twice a day or maybe more. And maybe, we don't like that as a kid, but we kind of have that habit and we do it. And so getting those tick checks in maybe around the same time, this is a natural daily part of life, to look for ticks, and you can help each other out, right? It's hard to see your back, so you can kind of line up and everybody can help everybody out, looking at your back and behind your knees, etc. All right, so let's move on to prophylaxis for Lyme and tick-borne disease. So why prophylaxis, right? So fewer than 50% of people with Lyme remember tick bite. And as I said before, half of people with Lyme remember bullseye rash. Also, it takes time for symptoms to appear. And conventional Lyme disease and babesiosis testing is not reliable. There are no testing options for tick-borne diseases like star eye and other Borrelia species. And it seems like almost every year they're discovering a new Borrelia species or other pathogen that's carried by ticks. So this is a reason to think about prophylaxis. Now, our high-risk populations, I talked about this a little bit, if you love gardening, if you're a farmer, golfing or hiking, all of these activities. And some of these are just a daily part of life for a lot of us. This can put you at higher risk for having a tick bite. So we'll talk about these tick bite formulas that I created. And we could spend a lot of time on this, but we only have so much time. So I want to make sure to get through the presentation. But over time at the clinic, I created the Dear Tick Bite formula because, as I said, people would come in with tick bites, and sometimes it's a tick bite and, it's been a day or two and it's too soon for symptoms to occur. So people wanted to be proactive. And certainly if it was me, I would want to be proactive because I see what can happen because I treat so many people with chronic Lyme and chronic complex illness. So I would certainly want to be proactive. I was offering this, and it's amazing now, just this year actually, Cryptolepis, there's this great study that just came out about Cryptolepis and its efficacy against Babesia. It's a long-term, like hundreds of years, it's been used for malaria, and Babesia is malaria-like. So it makes a lot of sense, and we've been using it, and I see that it's effective, but it's always nice to have that research. We certainly need more funding and research for herbal medicine. And then cat's claw, knotweed, houtunia. So all of these herbs kill the different pathogens that are carried by a deer tick. So the idea in creating this formula was that I wanted there to be, the best herbs we could think of to address all of those pathogens. And of course, herbs are doing more than just killing, right? They're not pharmaceutical antibiotics in that way when they're engineered just to do one thing really well. It's amazing how many different constituents are in herbs and different properties and how they help your immune system work in the face of Lyme. There's lots more on that in the book. It's great. So we have a preventative dosage. So some people choose to do this half dosage basically, and that's for like a high risk population. So I'll have some farmer, basically now, around now or a couple of weeks, they're outside more, getting ready for the season, and they're going to start in on their preventative dose. So you can take it like that and use it as a prophylaxis before ever getting a tick bite, or you could get it on board after a tick bite, certainly, and then it's a higher dosage to treat possible pathogens. And then this is our Lone Star tick bite formula, just to show that. But let's talk about what to do after a tick bite, right? So I'm so excited to announce this tick preparedness kit. So I talk about this in the book, and I finally created it and have it available at LymeCore. So if anyone's interested in having a tick preparedness kit, it's like a first aid kit with everything that you need in case of a tick bite. So we'll go through these different things. And then the big, one of the key elements is the Dear Tick Bite formula. So you have that if you need to get started on that after a tick bite. So let's talk about the 6 steps after a tick bite. So first, let's remove the tick, right? And I have my little Otom here. I love this guy. In the beginning, I was using tweezers, and you probably noticed how tweezers don't work very well, at least for me. I always mutilated the tick, and then the head's left in, or the mouth part. People call it the head, but the mouth parts are left in there. And then people worry about that, which I do not worry about. If that happens, just leave it in there. But this it slides right under. It's amazing how easy it comes off. So I highly recommend the Otom Tick Twister. It's in the kit. It's great to have around. You can use it on animals, on people. And then it always brings out the mouth part too, which is just kind of nice, right? I mean, our body will take care of that. It's just a foreign body that we'll digest and deal with. But, certainly a good thing to get out all at once. And it also doesn't agitate the tick as much. So, if we're agitating the tick, I don't recommend using a match or Vaseline. People use all sorts of different techniques because that's going to agitate the tick. It might regurgitate more of its saliva, which is where the pathogens are, into you. So really making this as easy as possible is great. And then we apply first aid. So andrographis is an herb that kills Lyme. And you can have a little tincture. This is in the kit. Have a little tincture to put 2 drops on the tick bite afterwards. And it's pretty interesting. I've had some great feedback about people saying that usually they have, really itchy bites. And this time after the andrographis, they're not itchy. It's just anecdotal. I don't know, it's interesting. Or they're less inflamed. So that's great. It's been really good feedback. But the point of doing it is to address this unfortunate circumstance of the tick. When the tick is attached, it releases feces on the skin, which you can't see. But when it does that, and then we remove the tick, some people then touch it or feel like it might itch. I recommend not touching it, putting the andrographis right on it so that it could kill the pathogens in the feces. And then it's been interesting to have good feedback about that. And then also what you could do is use these homeopathics. So we could spend time on homeopathic medicine, but for the sake of time, I will just say definitely after tick bite, you can use ledum. And then if you did have a bullseye rash or a hot kind of red spreading rash, you could use Apis as well. And both of those are in the ticket. Now, if you do have a red hot spreading rash, please don't just do Apis. Please see a medical provider and get that diagnosed and treated as well. But you can definitely start the Apis as you're doing that next step. Step 3 is to test the tick. So if you did have the wherewithal to remove the tick and save it, there's a little bag for that in the ticket. Then you can send it out to tickreport.com. If they've been closed a little bit on and off, unfortunately, during the pandemic, and they're opening, I think the 4th. So they're going to open soon. But at the moment, I think they're still closed. So the second option would be Ticknology. They're also very good. But I really love Tick Report. It's very thorough testing. It's very comprehensive. And it's really interesting to even go on their website, which is not up at the moment. But they have a lot of data from, I think, since 2006. So it's really interesting to see the ticks that have been found, where they're from, and which pathogens they're carrying. So when you do this, it doesn't take long. Obviously, you have to mail the tick in, but you can fill out the form online and pay online, and then you get an email back with the results after you mail it in. And then this can give us a lot of information, right? So if you had a tick bite, but the tick isn't carrying any pathogens, great. It's such a relief, right? If the tick is carrying a pathogen or more than one, then that does not mean that it was definitely transmitted to you. Important to acknowledge, but it means it could have been transmitted to you. And so therefore, you may want to definitely start that treatment, that deer tick bite formula. You may, want to look for very specific symptoms. Maybe it's only carrying anaplasmosis. So you want to look for anaplasmosis symptoms. Maybe it's carrying Lyme and anaplasmosis. So, you can get a lot of information from testing the tick. Step 4, begin herbal treatment. So if it's a deer tick, you would start the deer tick bite formula. So again, we talked a little bit about how this activates the immune system. It's targeting the free form of Lyme, as well as the round form or cyst form. It's targeting all these pathogens that the deer tick can carry, as well as biofilm that we talked about. And it also protects the joints, the neurological system, heart, eyes, and liver, because all of those can be affected by these different pathogens. There's our deer tick bite formula again. in our Lone Star tick bite formula. And then so we have step 5, watch for symptoms. So this is just a reference of all of those symptom lists we had reviewed. And step 6 is get tested maybe. This means you, the person who got the tick bite. And this is pretty complicated. I think it's really important to have this discussion with your healthcare provider. These are, and in the text, I list all of the tick-borne pathogens and then the best tests for each, because sometimes there's a test that's better done through a private lab like IGeneX, especially when we're dealing with Lyme or Babesia. The anaplasma testing, like I mentioned earlier, is really very good. And so you can totally rely on a regular hospital lab for anaplasma. So that's a relief. But sometimes we need to look at further testing beyond that conventional testing when dealing with Lyme or Babesia. Something to keep in mind. And so here we have our tick kit. We talked about all the ingredients in there. We've got the Otom tick twister, a small bag, the Andrographis tincture, the 2 homeopathic remedies, and the deer tick bite formula. And then we're wrapping up. We're almost there. We'll get to your questions. So just a little note on acute tick-borne disease treatment. So I would definitely recommend a Lyme literate practitioner, someone who's been educated beyond the conventional standard of care. And these are ways that you can contact, or you can find the contact information of somebody. So you can go to ILADS, you can go to Global Lyme Alliance or LymeDisease.org and give your geography, your zip code or whatnot, and they will email you back with some Lyme literate practitioners in your area. So if you have a family member in California or whatnot, you can always utilize these resources to get them connected. And again, just quickly to go through acute Lyme disease treatment. So just to make the differentiation, right? We're talking a lot about tick bite prevention of of diseases, and early treatment. So now, if you develop symptoms, now we're in a different place, right? If you develop the bullseye rash or a Lyme rash, or if you develop a fever, flu-like symptoms, new joint pain or muscle pain, we're now in a different realm of thinking about treating an active disease. So this is a time where it's really important to connect with a healthcare provider. And this is a time I use pharmaceutical antibiotics. So we can keep that deer tick bite formula going, but then add something like doxycycline if we know that it's Lyme disease. Add in some serrapeptase, which breaks through biofilm. Add in probiotics because we're using pharmaceutical antibiotics and we want to bring back the good bacteria. I also talk about specific formulas like Lyme or Borreliosis formula, which has a list of other herbs in it that are specific just to Lyme. So of course that would be relevant to treating Lyme, to transition from the deer tick bite formula to treating the pathogen we know is there. But this is getting a little more complicated, but just so you have a little template for how I think and what could be useful. For anaplasmosis, it really, the doxycycline works really well. You could also choose to add an anaplasmosis formula and the serrapeptase and probiotics, 2 weeks. And if it really only is anaplasmosis, the thing is, I think a lot of times people can go undiagnosed with Lyme, but the anaplasmosis is picked up. And if people continue to feel sick after that, it may be that the Lyme was not diagnosed and therefore not treated long enough. So I see a lot of people come to me with this kind of situation. Anyway, and then we've got babesiosis, very different treatment. Atovaquone and azithromycin are used as anti-malarial protocol because this is not a bacteria. Babesia formula has that cryptolepis in it. Salvia militarisca, which is red sage, is really useful in acute babesiosis. Serrapeptase for biofilm, probiotics. All right, we've made it through. I hope you're still there. This is just to show that you know, I'm a proud member of ILADS, and also very happy to work at this incredible little nonprofit in Southern Vermont, Sojourns Community Health Clinic. And here is my information. So you can purchase my book at a local bookseller. I think somebody in the area has my book, we know right now. Also, it's for sale at Sojourns, online, at Amazon, IndieBound, anywhere you buy books, basically. And if you want a signed copy, you can go to dralexis.chesney.com, or sorry, .square.site. It's right up here. And we can send you a signed copy, since we don't have the ability to do that in person today. And then that's my website. So I hope you can join me in ending Lyme and tick-borne disease through prevention. Thank you so much.
All right, thank you so much for this presentation. And yes, we have some questions that have come in, so I'll kind of just pepper them out there. Thank you in advance to everyone who had submitted questions on the sign-up form. I've been kind of ticking along, and I feel like a lot of them got answered in the course of the presentation. But of course, if you feel like you submitted something that's still lingering, feel free to pop it in the Q&A again for me to resurface it for me as I'm looking. One question that came in is this. If we find the tick attached and remove it within 24 to 36 hours, is that soon enough not to worry?
That's a big question. Yeah, we didn't get into that. So much to cover. So this is the thing. There are studies looking at basically from 6 hours to 72 hours with Lyme transmission. And in general, you will hear something like 24 to 48 hours. Oh, don't worry. You know, every place is different. It's amazing because I have patients report back to me all sorts of different things. So some people have sort of settled on somewhere between 24 and 48 hours. However, it has been shown to transmit sooner. Now there's a bell curve, right? So maybe most of the time it's not until later, but it's important to know that it does not have to be, you know, 24 hours or 48 hours. It can happen at 6 hours, and they did not test for sooner than that. Now, part of this issue is that 10% of the ticks that are biting people are actually partially fed already. So it's a tick that fell off of someone, you know, got interrupted basically in their meal of days long. And so they're primed to start that feeding process on their second host. And you can't tell, you don't know, you can't ask the tick, hey, did you, on your second meal, you know, that you were partially fed and now you're just finishing up. And so you were primed. So it's about 10% of the time. So when that happens, the transmission of pathogens can happen even quicker, definitely before 24 hours. So especially with that information, which is a little newer, really interesting. I think it's just, yeah, it's hard to know. I don't think there's any magic number of hours. And then the other thing I always say is, well, if you knew, you know, if you knew when the moment came that it attached to you, you probably wouldn't have allowed it to attach to you. So it's just a lot of guessing, right? I mean, we do the best we can with thinking how long it might have been on there. So, you know, I tend to be very proactive. Of course, it's your personal decision whether or not to do this prophylaxis type approach or just watch and wait. You could certainly watch and wait regarding symptoms. Sending the tick is really helpful too, in case it's negative, and then you don't have to worry. Yeah, I hope that answered the question.
All right. Another one, this is kind of, I'm going to combine two questions, but I think they sort of come together. Someone was asking, if Lyme symptoms can be dormant, how is one to know if they have been bitten? And a related question was, how do you determine if current symptoms are from a previous instance of Lyme or a current infection in the absence of a tick?
Yeah, I know. It's there's not necessarily a way to know. So a lot of the diagnosis of Lyme, especially later on, if we're not dealing with the acute stage, is really clinical presentation, meaning symptom presentation. The testing that's offered doesn't tell us if the Lyme is new, like within a month or two, or oh, this is Lyme that you got a year ago, but you still have. The testing just doesn't tell us that amount of detail.
Right. We had a question about the formulas. A general question about are the formulas safe for children, and related, is there any herb in the adult formula that a child should not be taking? Or in your book, you get into this a little bit, but I thought it'd be good for us to hear about it here too.
Yeah, so my main recommendation regarding the deer tick bite formula is safe for children. The thing that I run into is that it is extremely bitter. So some adults don't even want to take it. So Cryptolepis is very bitter. But I had like a 12-year-old who was totally into it. So you never know. So I make the recommendations different for children, which is optional. It's up to you and the child, just because I've run into that a lot with the taste of the deer tick bite formula. So there's the alternative to use Cemento, Mora, and Houtunia, which are 3 herbs from NutraMedix. And they just taste a lot better, Houtunia is the same, ingredient or it's also contained in the deer tick bite formula. Cemento is also called cat's claw. So that herb is also contained in the deer tick bite formula. So there's some overlap. Yeah, hopefully that's, and then it's always by weight, right? So the dosage is by weight. So you can do the deer tick bite formula, but if it's a 50-pound child, it's not going to be the full dosage of as an adult would do.
Right. A question here. If a tick is attached but not engorged, are you at risk of Lyme disease?
If that tick is carrying Borrelia burgdorferi, when you send it to get tested, they will tell you if it started feeding, which is helpful. So, once it starts feeding, it does start to get a little larger, but it's hard to see that with the naked eye, opposed to that picture that's, 5 days in, that's the complete blood meal. So, so that would be quite obvious, but in the early stages, it is difficult to say. You can't necessarily know that. Yeah.
A question about testing for Lyme. This person says that they have had blood drawn and had it tested for Lyme. Is this an effective way of determining if one has Lyme or other tick-borne diseases?
That the person was tested for Lyme themselves?
Yeah, a blood test.
Blood test, yeah. Yeah, so for humans, right, it's going to be blood testing. With Lyme, there are different tests available. So we can talk about that. This is a very, very specific topic unto itself. So as I've mentioned a little bit, there are these 2 standards of care, right? There's the CDC IDSA standard of care, which is conventional guidelines. Usually if you go to a conventional primary care provider or something like that. My computer did something, so I don't know what's happening. Sorry. All right, I just stopped sharing. Is that all right? I'm here. We're all good. So there are the 2 standards of care. So usually a conventional provider would offer the ELISA, ELISA, and that is actually been shown to be 20 to 50% accurate. Not very good, but this is heavily relied upon. And unfortunately, people, even if it's negative, have been told that they can't possibly have Lyme when the statistic, the accuracy rate of that tells us that this is not a conclusive test. And actually written on most labs that do this test, it actually states that this is not a diagnostic test. So this is where we get into a lot of controversy and discussion, but there's a lot of literature showing this fact, right? So if you wanted a better test, either the practitioner would have to be educated on this because they've sought out extra education, which there are other people than me in Vermont that have done this. If you contacted ILADS and asked for a provider that's Lyme literate, you would get a list, and you could actually go see one of those people, or come to Sojourns, and we would do better testing than the ELISA. So say that ELISA was negative. What I'm saying is it doesn't rule out Lyme disease. So the next step is a Western blot, and you can get a Western blot through some hospital labs. However, many of them will not do it outright. You can also get it through Quest Diagnostics. That's what we use at Sojourns. So that one's a little better. It's about 60 to 70% accurate. And when I'm talking, for those who know this, when I'm talking about accuracy in these numbers, I'm talking about sensitivity, how sensitive the test is. So that's a little better. It's not great. It's not perfect again, but it's better. So we might capture it. After that, the next level of testing is with a private company called IGeneX. And this, you need a special kit. So you would need a provider that has these kits, that has an account with this company like we do. And then we would send the blood to them. Now they have a Western blot and they've had one for years. That one's 70 to 80% accurate. A little better, and it is out of pocket. It's covered by Medicare, which is really nice. It's the only insurance that covers it. Otherwise, it's $250 out of pocket. And then the last and final best test we have is the IGeneX Immunoblot. And this one is 90% sensitive. So that's the best one we have. That one's $450 out of pocket. It's also covered by Medicare, not Medicare Advantage, but the federal straight Medicare, Part B. Of course, all this I say because I'm used to talking to my patients about, and I like to be thorough, but you'd have to obviously have a one-on-one conversation with your doctor about all this. So I do like to acknowledge that all of these tests, even though there's varying accuracy, we ended up here in IGeneX, the best one that we have, the Immunoblot, right? Any of those tests, if any of those are positive, it means that at some point you were exposed to Lyme. None of these tests that we have right now are able to tell us if you have active current Lyme. This is another point of contention. Typically, bacteria act in a certain way in our body that create an immune response, and there are different immunoglobulins made by our body. And we can utilize that and see a particular pattern. But with Lyme, we don't see that that's true. So basically, any of the testing done just tells us that you were exposed to Lyme. So I say this because some people have had Lyme in the past and they want another test. And actually, in my opinion, in my training, this isn't going to help us know whether or not you have Lyme right now, right? Going back to that other question. But if you've never had Lyme, you had a tick bite, you have some symptoms, and it's a month after the bite, then testing would be a good idea, most likely. And it would probably, be talking about that recent history, although we can't guarantee that. But, that first time of taking that Lyme test will tell us whether or not you're dealing with Lyme. So a lot of detail, but I know I always get these questions, so wanted to cover that one.
No, we appreciate it. A question that came in about the different formulas. You talked about the high risk populations, but would you recommend the formula for your average dog walker, gardener, or hiker? Is there any concern about taking these herbs daily for the tick season, the 6 to 8 months straight?
No, the only thing would be, let's see, cat's claw, if you're trying to conceive a child, can interfere with that. And actually cat's claw is fine once you're pregnant, which is interesting. However, other herbs in the tincture are not, so do not use it in pregnancy. In my book, I talk about what you can use. What else? Blood thinning. Cat's claw can create some blood thinning. Now, usually this is not anything to be alarmed about, but if you're on Coumadin, if you're taking blood thinners, if you probably know, if you're a person that is talking about this with your doctor, then you may want to bring this up to your doctor, just so that if you're getting blood work to monitor that, this could create more blood thinning, meaning you can have some bruising, you could have a cut that bleeds longer. So these are things to be aware of. In the regular population, we don't really notice that, even though it does have a little bit of a blood thinning capacity. So those are the main, and I talk about the side effects. There aren't many, but those are the main contraindications of those herbs. Yep.
We had a couple questions related to like pets in the outdoors. One was, should we avoid using tick tubes if we have outdoor pets? And another, and you got into this a little bit, I think, with the yard treatments, but are there yard treatments that are safe for pets?
Right. So there was a study, and I don't recall the details, but this question has come up before about, what if my cat or dog found the tick tube and ate the stuffing out of it, right? So there was some study that I'd have to find, but it was something like just an exponential number of the amount of permethrin on materials that would have to be ingested that would make a toxic effect, that it was just astronomical, that it didn't seem like a real world day-to-day concern. So it seems safe to use them in those cases, but that's a great question. And I think that covers it. Yeah. I missed the second part.
I think just like yard treatments, and if there's anything you should avoid pet wise.
Not that I think of. Yeah.
I had one about permethrin. Can I trust clothing sold with this product with permethrin for a certain number of washings? They claim that it will last. I know you talked about sending things to commercial vendors. But
Right.
yeah.
Yeah. It's a great service.
So it sounds like if they say it's a certain number of washings.
Yeah, 70 washings. Okay. Yeah.
Cool. Do ticks ever drop from trees, or are they always picked up from the ground?
Oh yeah. So ticks crawl up. Sometimes I show a video about that. But so sometimes people will find one in their hair and they may feel like, oh, it must have dropped out of a tree. That's pretty rare that it would come from above, unless maybe falling off of an animal or a bird or something like that. But ticks stay, basically low shrub to grass to just low to the ground, and then may be questing, like they kind of reach out off of a piece of grass or something that's kind of bringing them up a little higher, and then they'll hitch a ride on you, and then they tend to crawl upwards. It's really interesting. They just always do that. So yeah, they're just looking for a spot, and they'll keep going.
This one, is there an herb, food, or supplement that a human can consume that will make us a less desirable choice for a blood meal?
Not that I know of.
All
That's a good question.
all right, we're getting close to the end. I feel like this might be kind of a good one to wrap up on. Someone wrote, all this can make someone feel very afraid to go hiking. Is it better to just avoid the woods and stick to the roads?
Yeah, I know. Often this is a bummer of a talk, right? I mean, we live in such a beautiful area, and I do encourage people to go outside and enjoy the outdoors and enjoy their pets. So I think it takes a level of awareness and planning. And, I would encourage you to just embrace that and still enjoy the things that you love to do, and maybe make some slightly different decisions. And just also, do these preventative measures, like bring the cedar side or DEET and use some permethrin treated socks and shoes. And then just trust, you're doing what you can and enjoy your time, right? Yeah.
Sorry, I had to find the unmute there.
Oh, yeah.
The Zoom perils. I'm going to put your website in the chat for everyone. Oh, and I saw you just put that on there too.
Yeah, I was just going to add a few things because sometimes
Okay.
people ask me these things as well.
Yeah. And
Or in person, it lends to these types of questions more.
I know a couple of people asked about the recording. It says it's still recording, so if all went correctly, it'll probably just take me a couple of days to turn it around, get it uploaded, but I'm happy to share that with people that were on the list. I already have emails, but of course you can always send me a note. Again, Dr. Chesney, thank you so much. The book is Preventing Lyme and Other Tick-Borne Diseases. We have a copy of it at Carpenter Cars. I think someone mentioned that there are copies at Flying Pig. Yeah, so definitely thank you so much. And thank you to everyone who gave questions. I know we didn't get to answer everything, but definitely you may find more answers in the book. And you can check out some of these other resources that have been mentioned today as well.